Hello, today I'm going to talk about a unique problem or a rare problem. You might have heard of women who fail to conceive or who are not able to get pregnant, or they could be losing a lot of pregnancies without a reason. In other words, in medical terms, this is called recurrent pregnancy loss. That is, women are losing a lot of pregnancies one after the other. What is the connection between recurrent pregnancy loss and a rheumatologist? There are many diseases called autoimmune diseases. And there is one such autoimmune disease called Antiphospholipid Antibody Syndrome. I know it's a very difficult name to remember or even comprehend. In short, it is called APLA syndrome. This is a problem that could result in recurrent pregnancy losses or recurrent abortions. If a lady has unexplained abortions, which is not explained due to hormonal reasons or other reasons that a gynecologist has been looking at, then we have to think of autoimmune disease as a cause of recurrent pregnancy loss. This particular condition called Antiphospholipid Antibody Syndrome is probably usually due to small blood clots at the level of the placenta, which is the connection between the mother and the fetus. And blood clots there result in abortions. Likewise, lot of these women have either blood clots in their veins or in their arteries. They could develop either non-healing ulcers or ulcers that fail to heal in their legs. So, we do often get patients referred from obstetricians to look for any autoimmune disease that causes recurrent loss of pregnancies. The idea behind this is to see whether we can prevent these recurrent losses by giving certain medications even before they conceive or as soon as they conceive, so that the next pregnancy is not lost. So this particular condition called APLA syndrome increases the stickiness of the blood in a woman. And this stickiness in blood could result in clots anywhere in the body, be it in the legs, lungs, arms, or even a stroke. We do often also think about this condition when young people have stroke, because stroke is generally not a problem that is faced by young people. But if a young person comes to us, who is young? Somebody who's less than 40, who is not a diabetic, who doesn't have high blood pressure, but has a stroke for no reason, we obviously look for such rare causes called autoimmune diseases, which in turn could be resulting in the stroke. Likewise, if somebody has not had any of these blood clots, they could still be having recurrent abortions or time and again losing pregnancies. So for that, we do certain blood tests to confirm the diagnosis. And if the diagnosis is confirmed, there are specific treatments like blood thinners, like aspirin or heparin, which we give to prevent next pregnancy loss. Because these patients are at an increased risk of blood clots, they should be under the care of a rheumatologist. And also, depending on the need and necessity, we consider blood thinners. And with that, they could have a healthy, normal pregnancy as well as a healthy, normal life.